Hello, everybody. Have you ever felt that at the end of the day, you have no energy, you don't want to talk to anybody, or you just want to keep shut and lie low? Well, that's fatigue. And we often put this fatigue to, oh, I had too much work, I'm stressed. But you know something? It could be hidden anemia. I'm Dr. Rooma Sinha, Senior Gynecologist, Robotic and Laparoscopic Surgeon at Apollo Hospital, Hyderabad. Happy Women's Day to all of you. And this is one thing that I want you to take care of and understand why this is happening to you. Do you know what anemia is? Now, if you look into the government sponsored program or look into some newspaper and magazine articles, they talk about anemia and pregnancy. And I'm sure when all of you are pregnant, you take care of your iron content, you eat well, because why? Not about yourself, but you want the baby to grow well. We are always, as women, taking care of somebody else. And when we are pregnant, we want to take care of the newborn. But remember, you are pregnant just for a year or two in your whole life. What happens to the other 30 to 40 years when you are bleeding every day, every month, which is heavier than normal? That slowly creeps into a low hemoglobin status and causes anemia. May sound simple, but it's stark reality. And I will not be surprised if I say that in my practice today, it's not unusual to find one or two women every month who come with a hemoglobin less than 6 and 5. It's a shame. We should have taken care of ourselves better. And why did this result? And what does anemia do? Let's first tackle what anemia is. Anemia actually means that your hemoglobin is low. When your hemoglobin is low, what will happen? What does hemoglobin do? It actually carries oxygen to various parts of your body, including your gut, your muscles, your brain, and makes them active because it's supplying oxygen there. When your hemoglobin is low, the oxygen supply to all these vital organs is low. That is why you feel tired. You can have sleeplessness, you can have hair fall, you can have palpitations, you will be breathless when you are walking or climbing stairs, and all this actually is a sign that you should take better care of yourself. Now, why does hemoglobin go down? The commonest reason in women is heavy bleeding. Now, as women, we have periods every month. We take it for granted. But you remember what happens? Every month you may find, oh, this month I had a little heavier bleeding on this day. And then you'll carry on to the next month. Then you will say, oh, this month I passed a clot, which I shouldn't have. But okay, let me see next month. This month I used one extra pad or a tampon. Oh, it's okay, I'll see next month. And you carry on with your work, taking care of yourself, your family, your career, your neighbor's dog, everybody. But this little extra bleeding that happens every month creeps in slowly and your hemoglobin drops. So women, when would you feel that you are bleeding more than normal? That's the good question to understand, right? Now, when do you feel you have more bleeding than normal is number one, as I mentioned, if you are using more protection, which could be extra number of pads, tampons, menstrual cup, whatever you are using. Number two, if you're bleeding for longer days than you should. Supposing you had periods for 3 to 4 days, but these days you are bleeding for 7, 8 days. Number three, if you are using more and more protection, as we could call it. So these two actually indicate that you are bleeding more than normal. So when should you see a doctor? If this bleeding is heavier or now you start having a pain associated with this bleeding. These two are signs of a gynecological disorder. And what those gynecological disorder may be? You could have developed fibroids. If I look into a room full of 10 women, 3 to 4 may have fibroids, but they never know about it unless you do an ultrasound. Or you may have something called as adenomyosis and endometriosis. This is just something different than fibroid, but I call them kind of cousins. They sometimes stick together or stay together. But endometriosis is something where the lining of the uterus, which you have inside the lining, that lining grows outside the uterus, near your ovaries or your bowel or something else. And every month when this lining grows, those tissues grow too. When it bleeds, it has a passage to come out through your cervix. But those tissues have no place. They keep collecting there. They become blood collection, and blood is always very sticky. It makes the organs around it stick together. So the rectum will come and get stuck to your uterus. The ovaries will be stuck there. Sometimes the bladder may be drawn up. And all these will give you, other than bleeding and anemia and pain, some non-specific symptoms like bloating, menstrual headache, fatigue, nausea, vomiting, unable to eat. All these symptoms you actually sometimes never reach the gynecologist. You may end up going to a physician or a gastroenterologist for these things. The other things that can cause heavier bleeding could be just pelvic infection, or it could be where the uterus is swollen up, which is called adenomyosis, where again a similar thing like endometriosis, but this tissue, instead of growing outside the uterus, grows inside the wall of the uterus, and that enlarges the uterus and makes it very painful. So you have to understand these gynecological disorders can creep in slowly. These are the years and days away from your pregnancy. When you are pregnant, you go for a regular checkup, right? So when you are not pregnant, at least go for a yearly checkup and make sure that somebody examines you, does an ultrasound, and see that we are not dealing with any kind of gynecological problems. When the bleeding is heavy, you should also look into what other problems is it causing. And as I mentioned to begin with, anemia is one of them. If you feel tired, if you have several backache, don't just normalize your symptoms and carry on. You need to look into them if they are troublesome every day. If any pain during periods or outside the period is intractable, that means it does not let you go and do your regular work, or make you very young going to school. If it is letting you miss a school or miss your college, or you have to take a menstrual leave in various corporates that they are allowing, then you must consider them to be a serious matter. And that's the time when you should meet a gynecologist. And as a gynecologist, let me give you good news. Most of these conditions are easily treatable. Believe me, many of them are treatable just by medications. So we have multiple medicines which we can help you reduce the amount of blood loss. And some of them are as simple as you just need to take them during your periods. So just 2 or 3 days during periods, if you take, your blood loss is less, anemia does not result, you are as hale and hearty and running the way you want to. Some of them may be a little bit longer treatment. Some could be a hormone-related treatment, which will be cyclical. Or we sometimes have a kind of intrauterine contraceptive device, which we actually put inside your uterus. And if it works for you, it works for 5 years. It's called LNG, intrauterine contraceptive device. So all these can control the amount of blood that you lose and let you not get into anemia. But here is a little serious matter. Sometimes these problems are beyond medical control. And when that happens, you need to actually then look into a surgical option. And that surgery could be just treating that condition, or treating that condition along with the uterus and ovaries. And then we as gynecologists at that time discuss with you what exactly is your problem and what you should be able to do it. So in all this, let me give you the brightest news. News that this is usually a non-cancerous condition. Very few of these are cancerous condition, so don't get worried and not reach the gynecologist. If you reach us, what will we do? We'll ask you questions, examine you, maybe do an ultrasound and prescribe. As simple as that. So, women on this Women's Day, although I don't believe in this concept, I believe we are strong enough to be Women's Day every day. But okay, let's take 8th March as Women's Day, and let's understand that anything that you do, take care of your health because you are important. Thank you.